Today we welcome Suzanne Dupuis-Blanchard from Moncton, the most popular city in the Canadian province of New Brunswick. And it's an hour later than where we are today in Toronto. So evidence, the gathering of it, the creation of it, the mobilisation and translation of it to inform policy has been Suzanne's bread and butter for more than 3 decades. But how did Suzanne get to this position? It was the real lived experience. So underpinning all of that, Suzanne, you are an accomplished, eminent researcher in the field of population ageing, former chairperson of the National Seniors Council, co-chaired the New Brunswick Council on Ageing for the development of a provincial strategy on ageing, worked with older people in minority communities. The practice and experience as a registered nurse is an undeniable thread with experience in community health and ageing. What was fascinating, Suzanne, as I read up about your experiences was, this concept of nursing homes without walls, a provincial program for ageing in place, for which you have been recognised by the United Nations Healthy Ageing 50 initiative. You have been honoured in many ways, too numerous to do justice in this global cafe. But clearly your contribution in Canada and globally is both significant and humbling. So we welcome you here today to have a conversation with many, many people from around the world. So perhaps if I just hand the floor to you for your opening remarks, but I've got a series of questions which I hope will guide the discussion.
Well, thank you for that lovely introduction, Jane. And it is a real pleasure to be here this morning. And even though it's early for some of us, as we've just heard, but I am grateful to be here among you, and especially to talk about my passion, which is not only aging, but also my belief about how we can support or best support older adults to remain independent to their full potential, but also to be able to age at home or in place. And I'm sure we'll have a discussion around what that actually means and whatnot, but it has really been my passion for almost all of my career. And I don't know what would have happened if I wouldn't have started my career in public health, especially in a specific older adult directorate. So all of my work that I was doing in public health at that time was towards older adults. And I truly believe, even to this point in my career, that it really shaped how I saw aging. And also what I thought was most important, and that is living in the community, surrounded by supports, but also very much realizing the needs that were unseen of these older adults that were living in the community. So like I said, I truly believe it's shaped most of my career, including my studies, including my research, the teachings that I do around students and whatnot. And I'm very pleased to be able to discuss it this morning.
Look, thank you. Suzanne, it's not going to be surprising to you that some of these questions are a little bit tricky. I can hand on heart say that generally across Canada, we're not leaders in the field of long-term care. And, your career has really been a pivotal lever to policy development. But let me start off by saying, having been at the heart of evidence and policy development in Canada for some years now, are there any historical issues such as jurisdictional responsibilities that hamper the advancement in long-term care and, quality of life for older people? So what's your perspectives about how are we dragging historical issues to the table all the time?
Yeah, it's I think you've identified it, and it's the jurisdictional seniors or older adults or aging belongs as much to the federal government. And I say belong, I mean, you know what I mean?
Yeah.
As much a responsibility of the federal government than it is to the provinces. And I think it's always the pull and push of saying, well, whose responsibility is this? And we know when it comes to healthcare, it does belong to the provinces. However, each province has its own way of providing healthcare and social services to older adults. So it's always been, when it comes to policy, to get back to your question, it's always been, well, whose responsibility is this? Where should the funding come from? What supports are we going to get? And I feel like it's always sort of a back and forth between our federal government as well as the provincial entities as well. And I mean, we're going to have to come to a point where we decide to work together, because we can't deny that Canada has an aging population, and certain provinces have it even more than others. For example, here in New Brunswick, where I am, we have 22% of our population that's already 65 and over. And in some of the communities that I work with, we're talking about 34 to 36% of their community local population that's over 65. So the element of aging is very much present, but then you get to a policy issue and trying to actually change the way that we provide that support, or that we provide income or housing and whatnot. And all those, most of the time, or some of the time, it looks clear that it belongs either to federal or provincial. When it comes to really dealing with an issue, it's always that back and forth. And I think some of those issues, like you said, it's historical. It's also our structure around these, elections where it's a 4-year cycle. No one wants to take it under their responsibility. I often say that because, we're almost looking at it in a short term instead of a long-term planning of how we can best support older adults. And it's really, we're like I said, we're really going to have to deal with that. And historically, we've also been the land of pilot projects, right? And we hear that often. And I think there's a space there for pilot projects, but it's also the after. And again, it comes back to policy. It's because we have no direction. We have no long-term vision of where we're heading. And it's really something. It is really complex.
So, Suzanne, I'm just going to ask a very basic question, so that everybody at the cafe today, and we've got full rooms, and I just want to acknowledge a dear friend, Jim Hamilton. Good morning, Jim, from the wickedly cold Winnipeg.
Yes, I know Jim as well. So good morning, Jim.
Suzanne, just for everybody on the cafe today, I live in Ontario, but if I move to Prince Edward Island, are the services that I receive in Ontario going to be the same as in Prince Edward? Are the regulations that govern residential care going to be the same?
No, and that's the problem.
Okay.
That is, it's the problem. It's also the way our province's healthcare is designed. So like you use, for example, if you relocate, if you are from one province and think that you are going to retire in another province and have the same services, absolutely not. And so that's a big problem. But there's also other bigger issues, especially when we talk about home care, because home care is not included in the Canada Health Act. And so home care, when we talk about that, it comes back to, okay, so what do we do about home care? And who funds home care? And, what does it actually mean? What kind of supports are there? And that opens up a whole other issue of, again, that historical way of doing things before our population changed. And now here we are with, less younger people who are 15 and under and more older adults, but we've not changed anything. We've not planned for it. And it is very problematic. And even just the older adults portfolio in each province. I know here in New Brunswick, it's under our Minister of Social Development. And many provinces, it's under their health, Minister of Health. And so even between provinces, it is very much different, and very much different in the approach that we take, and where we think older adults, the portfolio of older adults belongs. And so when in my way of seeing things, I tell myself, okay, so when these ministers of health across Canada meet, or social development, or whichever ones, how can they actually, I mean, they're having conversations about aging, but also it's very difficult to compare, because they're all coming to the table with something different. And so when we talk about spread of projects, or spread of, evidence-based practices and whatnot, it becomes very difficult to adapt. And it's very much a time frame issue as well. When we talk about policy, people will say, well, why is it taking so much time? I've seen how much time it can take, and it's very frustrating, because you want changes right away. You're seeing issues on the ground where changes are needed, but by the time it goes through the whole process of policy development and actually becomes a program, or something bigger than just a project, or a local program, it can take years. And by that time, we're probably looking at something new that's come upon, or something that changed. It's very, very complex.
Look, I'm going to come back to that point, because I think it's a really important sort of area to raise. But I do want to just move now to this Nursing Homes Without Walls program.
Yes.
And it's a program that aims to allow more people in New Brunswick, seniors, to live at home.
Yes.
And it has attracted considerable media attention. I think the first question is, why has it attracted such a lot of media attention? Because we would have all thought that there was a program in place. So tell us a little bit more about, the program, what evidence you are actually able to create to inform the policy levers that gave rise to this initiative.
Yeah. Well, thank you for that question, because Nursing Home Without Walls is a program that is actually based on evidence as well. So it's based on the work of my team and others in the field of aging in place, where we've realized why older adults cannot age in place at home. And based on that, it seemed to be so simple, but so complex at the same time. When we're talking about why older adults need to relocate from home, we are talking about access to transportation, access to help with meal preparation, with maintenance, with socialization. It's not the big medical issues that we tend to think about. And as far as the medical issues, as far as medical home care, whatnot, many seniors that I've seen, be it in Ontario when I used to work there, be it here in New Brunswick, is usually not the things that come up when people talk about aging in place. It's very much the social aspects. And so based on that, and based on kind of a brainstorming about long-term care in general, long-term care institutional, but also long-term care community-based. And having brainstorming sessions, and just thinking about, okay, so what's the future? Where are we heading? And thinking also of the discussion that always happens around, oh, well, it's going to be too costly. Oh, that's not possible. And it was kind of having a moment of, okay, so let's look at the resources that are already in place in communities around aging. And right away, it was, well, long-term care institution, long-term care, nursing homes. What if we based programs for community, for seniors in those communities, based out of nursing homes, providing them with extra resources? I want to emphasize that, not with what they already have, but with the appropriate resources, and for them to be able to reach out. So, the barriers of the home, the walls, let's get rid of that, and let's provide services that are needed. And that's exactly what we piloted. So the nursing homes, I'm sure most of the people that are listening to this are wondering where where these resources are coming from. And I will answer that right away, because many of the nursing homes that we had the pilot project had part-time staff, but no funding to make them full-time. And so the part-time staff was given an option. It was not forced on them, but given an option of working their part-time in the nursing home itself, but also the other part-time in the community. And some of the staff we hired was not necessarily staff that had a nursing or a care attendant background either, because we didn't need that. So it really came out, it's a very community-based model. We did needs assessment in the local communities. We came to understand that, yes, the research that we had done and the consultations that we done to establish the needs in those communities were very much the same. And based on the priorities that were set by the members of that community, we are providing the services. And there is absolutely no duplication. Many of the coordinators in Nursing Home Without Walls are actually referring to programs that no one even knew existed. And that's the biggest issue, is that lack of information on what actually exists, how you access it, and how you actually apply. And so our philosophy, if I can say it like that, is that we don't go in, we don't talk to an older adult with a checklist. We say, what can we do for you? How can we help you? And we figure it out. We've gone to linking people to home care because they didn't know how to access it, to doing roofs and replacing windows, and linking people to services, helping with the application, the follow-ups, and it's really made a huge difference.
It's really interesting the way that you talk about it, because you did mention, long-term care. Mm-hmm. And definition in WHO is services in the home all the way through to high-level services in right. So you mentioned that. Yep. There was also some tone about social prescription.
Yep, definitely.
About what do we need to put in place.
Yep.
There was also this feeling for me about integration.
Definitely.
We don't know what we don't know is out there.
Yeah.
And it's about, so this case management kind of philosophy comes in.
Yeah.
How did you convince the policymakers? Because what they're interested in, let's be frank, it's about the economic burden or contribution of older people.
Yep.
So what's the business case for this particular program?
Well, the business case is that the pilot project, it was a pilot, so I do acknowledge that. Actually, the concept worked this time for a pilot project because we were able to have the data to support what it is that we're doing and to show how it actually has an impact, not only on individuals and communities, but also the healthcare system. Our participants have actually, they've shown that because we were there and because they knew where they could actually access services, they did not present themselves to emerge for a non-urgent matter. They had other venues. And if the Nursing Home Without Walls program wouldn't have been there, they actually said, we don't know where to turn, but we know that we can go to emergency department and they are open. They are there and they'll tell us something. They will help us. So just that, I think, is a huge issue, but it's also the cost involved. We can provide sort of preventive care. I'm using care as the word, but supports that will actually stabilize or maintain the health of older adults. And I mean, the goal of Nursing Home Without Walls, or the vision, is certainly not to prevent admission to an institutional long-term care facility, but if we can delay it, it's certainly, if we can add a year or two of good quality of life with appropriate supports, that makes the difference. But the other issue to answer your question is also that constant relationship building with policymakers. The policymakers need to be informed, need to always be abreast of what is happening, what impacts is it having, what are the challenges we're facing, and establishing that open communication and that collaboration. And yes, it takes time. Yes, it's extra work. If we can, I also teach, I have other research, I have, yes, it's extra time, but when it all comes together, does it ever work? Now, the other issue is, of course, sustainability, because you heard me say that it was a pilot project. So in that sustainability sort of thinking about the next steps, you need those policymakers, you need government present, and they need the data. They need to have confidence in the work that's being done and seeing the difference it makes in their residents, in their I mean, these people vote as well. And it's so you can link it up to many, many different aspects. And we have provincial strategies on aging as well that have not always necessarily maybe produced the results that they should have, but it certainly fits into that. And so you kind of make it so that it helps, and it helps connect the services that are already in place as well. It's that non-duplication as well.
Hallelujah for non-duplication. I'm
Yeah.
just going to turn to a couple of questions.
Sure.
So I'm going to ask Joan Duke and Famada Shaman to come forward. So Joan, if you can ask your question, and then I think what we'll do is we'll go straight on to Famada because they're linked. So Joan?
Yes, I just want to know how this would be financed in the community, because I can see I'm in that kind of a position where I could certainly use that kind of a service, but would it be within the government funding for long-term care or for assisted housing or long-term care, or would it be on a per service use, or how would that probably work?
Okay, I'll hold that question and we'll go to Famada. Famada Shaman.
Yes, hi. Hi, everyone. Thank you so much. This is a very interesting conversation. So I'm from South Africa. I'm just very interested in terms of one of the, I would assume, unintended outcomes is that you have a geo map of services in a particular location. And I was just interested in terms of how do you use technology to make that accessible to others. So I assume that when there's an intervention, you want to look at sustainability and you want to look at ways in which older adults can access this beyond the immediate intervention. So as a long-term strategy, is that something that perhaps you can speak a little bit about?
Certainly.
Famada. So back to you, Suzanne, from Joan, and then Famada.
Yes, thank you both for those questions. Right now, so the province of New Brunswick has decided or has announced the expansion of Nursing Home Without Walls. And I'm working with our provincial government to expand that to additional nursing homes. And so it is becoming a government program, if I can say. So it will be part of our suite of services, I guess, if you can say that, through our aging portfolio, so under our social development. And that's where right now it will sit. And I guess before that was decided, it was the big question about, okay, so we've created this expectation now that these services are going to continue. And that ethically was really, we were really, really thinking about this quite a bit, because we did not want to all of a sudden disappear. And so we did have conversations with local communities and local groups and how we could best continue, maybe not everything that we were doing, but try to do some sustainability. Some volunteers did come forward, but it would certainly not have been, sufficient. And I think this really needs to be embraced by the government in place and really become sort of the services that are available. There could also, at this point, the funding, seniors do not, older adults do not pay for most of the services, because most of the services are, once I have in the project, once the coordinator or the one or two people involved in the project locally are hired, they do most of the work. And because there's a lot of referrals being done as well to services that are already funded through the province, or to who ask seniors to pay a certain amount or whatnot. And so we have not had to do that. It was actually something we were thinking about for sustainability, but older adults in our program said, yeah, maybe, you know, we'd only reach out when absolutely needed. And we know when that's absolutely needed, there's usually a crisis already in place. And it's very much more complex. About the geomapping, so we're in the pilot project. We are not doing any geomapping per se with a program or anything like that, but I can say that we are certainly taking notes of the services that we are referring to, the services in place, and to make it quite easy or accessible to the population, we have developed sort of a guide of services for the local communities. And so I wouldn't necessarily call it geomapping like I'm thinking of geomapping, but there is sort of that magic list, I can say, that keeps being added to and revised and whatnot, that does exist, and that has actually been quite popular for the local health services, the local community health centers, even the physicians' offices who did not know usually that those services existed. And that was one of the comments that we received when we did that that beautiful document. People would say, we have all that in our community, we have access to that. People have no clue, because we can talk about all kinds of services. If it doesn't concern you at that time, you're not paying attention, right? But if all of a sudden it concerns you, now you're listening. Now you want to know. But sometimes it's too late, right? Because you're already in a crisis.
Yeah, look, and I saw Jim Hamilton nodded. It's quite true. You only seek services when you need services.
Yep.
But I think it's important, you know, back 20 years ago, Australia actually did do the geomapping of all the services, so that you can go on to the site and actually identify services in your area. We have two more questions I'd like to go straight on to. So Kathy Pecora Fuller and also Antonio Carvalho. So Kathy, thank you.
I think that this topic is kind of coming up in some of what you're saying and some of the comments, but you know, I'm a person who has worked in a clinic and became a researcher and worked in the ivory tower, and I don't know anything about policy making, but I'm trying to learn. And I have heard people I'm in British Columbia, from our provincial Ministry of Health and also from the federal Ministry of Health, basically tell health researchers, you know, you guys have the science, you have the results of your studies. We want to use that and make evidence-based policy, but it's never going to go anywhere unless the public understands your research too.
Yep.
And I think this has, been behind your comments about nobody knew what was going on. So I thought, well, you know, that makes a lot of sense. That and Dorothy Pringle, who was, you know, one of the huge leaders, you know, decades ago when all of these needs were first backed up by science. When I first met her decades ago, she said, it doesn't matter what you do as a researcher, that's never going to make policy. So I think she might have been onto this too, that it's not the studies we do, it's not the models we make, it's actually communicating that to the public, which is the necessary ingredient to the policymakers picking it up and deciding to spend those dollars. So is that just something we have to learn, how to actually do that communication?
Yes, definitely, Kathy. I love your comment. And, you know, this is very much, like I said, community-based. And when I say community-based, it's because the people are involved. and because the people are involved, they really are ready to voice the need for it to stay in the community, but they also understand it. So, you know, they will contact their local MP, they will contact provincial government. They have really embraced it because it has been developed that way. I'm the researcher there, but I'm always in my community roots as a community health nurse, right? As a public health nurse. And I have not let that go because I think it's the best way to inform what we do as researchers and in academia. And again, I so appreciate your comment, and it is so true. I do believe it is it's not the secret, it is what we should be doing. And especially now when we talk about person-centered care and person-centered research, and we involve people in our research like we should have always done. I've always done that. And I've had colleagues say, why are you doing that? Why do you have this person coming from the community who doesn't understand anything about research? Well, because they can inform, they can bring us back to their reality and make sure that, you know, the research we're doing, because it is applied, will make a difference. And Nursing Home Without Walls is very much that, is very much in the roots. We have a community advisory committee, and they are local people, and they provide us with a bit of guidance if we have questions, but they are also our leaders in the community to talk about what it is that's happening and getting people to know it. Oh, you've not reached out yet to Nursing Home Without Walls? Oh, you really should. And these are respected members of the community. And so people do believe in what's happening there. And it has been, in one of the communities, we have over half of the full 65 and over population that have accessed or interacted with Nursing Home Without Walls through our activities. Over half.
So so look, I think that's a very comprehensive response. I think we do have to be concerned, though, that it's still sitting in academia. You've got one pilot program and you've expanded it. So I just put that point to one side. I'm going to ask Antonio Carvello and then Dominic Boyd. Dominic makes a really critical point to this conversation. So first of all, Antonio, welcome.
Thank you. Good morning.
Good morning.
My question has to do with the design, because I'm an architect and I teach design in Italy in Politecnico. So I have students from all over the world, and I work with them on designing spaces for older people, in the sense of enabling people to age in place.
Yeah.
And in that sense, the idea I have, it could be a wrong idea, of course, but the idea I have is that nursing homes provide too much service sometimes, and that keeps people from keeping active. Yep. Because there's some tendency of doing things for people, helping them too much instead of promoting their autonomy. Yeah. But when they stay at home, and in the community, they might keep a bit more active. So I'd like to, if you could say something about active aging and how this relates to the community, and also, from your experience, how do you and your Nursing Homes Without Walls, how does that relate to the public space? Because sometimes both the houses, and the public space are not prepared to allow people to stay and to keep as long as possible. Of course, there will be some limit where they will need more help and they will need to move. Yeah. But anyway, I truly believe that as architects, we can, and urban designers, we can contribute to prepare the future. Because the problem is that what we have today was not prepared. But if we prepare it from the very start to have some inclusive spaces for all people, when time comes and the needs arrive, the space could be ready for aging in place. But I would like to hear your expertise opinion, please.
Yeah, thank you very much, Antonio, and welcome from Italy. Very important, but it also connects to Dominic Boyd's comment. So Dominic, would you like to come forward, because there is a relationship between your comment and that of Antonio?
Thank you very much, Jane. Well, my concern here is that we don't see seniors just as consumers. We don't see them, sort of patiently waiting for programs to occur, but we see them as having contributions they can make. These folks have worked, they've raised families, they've been involved in their communities. The need for purpose and meaning in our lives doesn't stop just because we hit 65. And so when we talk about the nursing homes without walls, are we able to incorporate the gifts that our seniors have in an empowering kind of way, that they engage in the development of these programs from the start, and that these programs are meaningful and call on them to be able to employ their gifts in meaningful ways?
Thank you for that question, Dominique. They have been involved right from the start, and very much active. And those who are in more, I guess, semi-independent, are more semi-independent, or have more challenges, I can say, are still actively involved. They have done all kinds of intergenerational activities with the local school, very active in writing letters and telling stories, and being involved even as volunteers in the buddy call system that we have. So it's not only, we are definitely not only going in one direction here. We are not only providing services, but when we see that we can ask them as well to give back, and that there's a willingness and that they are open to it. Our goal is really to empower, is definitely not to do for them, because we don't have the resources to do that. It is very much an empowering, and maybe it's a time in their lives in this next few months or something that something's happening, but the goal is certainly to bring them back to their optimal level of autonomy, whatever that is for them. And but keeping them involved, I would say, is one of the key areas of keeping people quality of life, satisfied, but also very much an interaction with Nursing Home Without Walls in this case, so that if something does come up, they do not wait until it is too late to actually reach out. There's an active engagement there. There's back and forth. And I mean, they take part in all kinds of activities. I mean, we're talking about walking groups and all that, but we're also talking about them realizing the importance, and this comes back to Antonio's comment about being an age-friendly community, and they've embraced this. They are asking their municipal elected officials, okay, well, we need this space, we need this to be more accessible, and it's really a discussion that has gone way more, way broader than just the individual. We're including the neighbors, the families, and whatnot. And in one site where the project is being piloted, we also have local community older adults coming into the nursing home. So one of them has not had, I have 4 sites in the pilot project, and they're not exactly all doing the same thing. And so some of them have decided that the older adults in their community may be a bit more frail and would need something like a day center, but it's not available. And so they're bringing in, they are using their minibus. Many of the nursing homes have transportation that adults only use once in a while. They have used that to go and pick up older adults, bring them to the nursing home for personal hygiene, for maybe help with washing their hair and whatnot. But they also stay to socialize and stay for a meal and go back with a few meals for a few days. But they also give back even in that context, because the older adults that are coming in from the community and going into the nursing home are socializing with the residents and are enjoying that, because it's usually people that they knew before that they haven't seen because they haven't been there to visit. And it's just been this dynamic relationship building that's happening. But they are very much active. I want to emphasize that it's one of our main goals is to have them very much take part in what we're doing in their community, because it belongs to them.
Yeah, I guess I also want to talk about environment, Antonio. Yeah. You know, because we talk about creating an environment that enables, right? Yeah. And we talk about enables older people to do what they have reason to value. But in fact, it's not older people, it's everybody.
Exactly.
It's everybody.
Yep. And
I continue to believe that we're using the same words that we used 20 years ago. A daycare centre. Yep. I don't want to go to a daycare centre. Yep. Thank you very much.
A day centre, yeah.
Yeah. I don't want to go to a nursing home either.
Nope.
Thank you very much. And so we actually have to be brave and change the language and force government to change the language.
I agree.
And talking on language, I'm just going to ask Jim Hamilton to make a comment and then Valerie Powell. So Jim, you've got a long history in this area and leadership.
Thanks, Jane, and good morning, afternoon, evening to everybody. I think the dialogue piece is really important, and reflecting that it's 17 years ago that we started and created the notion of age-friendly communities. It's been around for a while and continues to gain traction. But one of the things that the WHO, I think, gives us good advice around is that we need to change the dialogue from cost to investment. And I go back, Suzanne, to your earlier comments about some of the challenges of engaging the elected officials and the bureaucrats as well, in terms of getting traction for, an initiative like the one that you've been able to have such great success with. So maybe just, that concern about how do we use the right language in order to shift the thinking, and maybe that creates better traction, better support for developing policies and programs.
Thanks, Jim. I'm going to go to Valerie, Catherine, and then Chris. So Valerie, you've been very, very vocal in the chat today.
Yeah, sorry. I can be very vocal because I come at it from a history in healthcare.
Yep.
I'm the full-time caregiver for my husband for 9 years since the stroke, so I'm going through a lot of it.
Yeah.
And I helped to create policy for Green Party of Ontario and Canada. And I'm going to jump straight to that. Whatever party you're involved with, get involved or get members, because members create policy. They're the ones who submit policy to conventions. Those policies are voted on, and then they become part of the platform. So nobody wants to be political, but that
you have to.
You have to. And if you don't want to do it, find somebody who is and get policies. Green Party is great. We're not elected, but they love to steal our policies. So we like to create really ones that really push the margins. I love your talk. I'm both excited about the possibilities and frustrated by the reality. And even in my own reality, our house is way too big, has stairs, is too expensive and challenging to maintain. But trying to find that middle ground between owning your own home and, let's say, a long-term care, there isn't a lot out there. They're trying to create it, and creating these little seniors villages when I worked, I found that that wasn't the answer, because if you're not integrated in the community, people start to just pull their blinds down and become isolated again.
Yep.
So you need to have these little naturally creating communities,
Mhm.
garden houses, tiny houses built in,
Yep.
condos within the community.
Yep.
I could go on and on. It affects housing, transportation. Anyway, I'll be quiet, but I'm very excited about possibility, and then trying to figure out how to get there.
Yeah,
Well,
we don't want you to be quiet, Valerie. So I'll send it back to Suzanne, but we've got 3 more questions, Suzanne.
Okay, I'll go quickly. I just want to say that my previous work and research has been around congregated apartment buildings for older adults and the benefits of them, but also when they're lacking, especially rural communities, if I speak from my experience in New Brunswick, is that you either live in that big 2-story older family home, or you go into assisted living or nursing home, because there's no in between. And that is a real issue that we're seeing right now in many of the communities, is because how do you downsize from that when there are very little other options? And so we have to be very conscious. In previous work we've done, we've seen that stairs, going to either the basement for the laundry or going upstairs for bedrooms and washroom is a big issue, as well as the way that the home is organized, stairs outside as well, but also preparing for what you're going to do when you do need care. And it's making the home and the environment safe. It's not only the home itself, but it's also the environment. And when we talked earlier about age-friendly communities, we're talking also about, you know, the sidewalks and the space that people live in, and is that safe? And when we make it safe for older adults, we make it safe for the whole population, right? We do call it age-friendly communities, but it's any age.
Yeah. Okay, I'm going to move on to Catherine and Chris, but you made a point. You said when we need care, and I would offer that if we need care.
Yes.
Because, you know, so I think that
Yep.
we've actually got to even shift that. So Catherine Fries, and then I'll call on Chris Cobus. Catherine?
Good morning. Building on your comment about the diverse ways that government organize policy work for around older adult issues, if you could wave your magic wand, what's the most effective way to organize this type of work for best efficiency and knowledge transfer? Thank you.
Oh boy, Catherine. If I'd have a magic wand, I would say one way of doing it is certainly through meetings, communication, having them talk to the people that are being impacted for real life experience, and also cut down on the time that it takes to actually make it into policy. Does that make sense? Yeah. Okay.
Yep, makes sense. So Chris Cobus?
Hello, Suzanne. Thank you for your talk. I'm really happy that there is investment happening in community-based services. I'm not familiar with what community support services already or currently exist in New Brunswick, but I've been working for over 30 years in the community support sector in Ontario. And as I'm looking, as we're talking at your Nursing Homes Without Walls program, it sounds almost identical in terms of the services that are offered by community support services in Ontario. And I guess that would be my question, is that if those exist in New Brunswick, is there investment happening to ensure they can respond to the referrals from your program out to the community?
Yeah, that's an excellent question. The services that do exist and that we rely on or that we refer to are actually part of the aging in place, if I can say, program of the province. And so they are certainly responding I can't respond to the investments that are made. I mean, that's beyond what I'm involved in, but I can certainly say that up until now, they have been very responsive to our request and have actually provided even other referrals. And it's been a very collaborative work. So, and I know where you're coming from by saying that many of the services are there. The problem is, and we've seen the same thing, many of the services are there, but people don't know about them. And they also, from our experience, are afraid that if they call or apply, they will be asked questions they cannot answer. And that will, block the whole thing, or will not make them able to have access to those services and whatnot. And it's going also beyond what is already offered, right? But it's bringing people to that level. And so I can only answer by saying that thus far it's been a success. I feel like there's investment there. Of course, there could always be more. That's without saying, of course. And yeah, that's to the best of my abilities, actually, that I can answer that.
Look, thank you very much, one and all. I get to ask the last question, Suzanne, and that's before you get to tell us about your takeaway messages.
Okay.
Look, I'm thinking in the future.
Mm-hmm.
We're sitting here in 2028. Will there be national standards in long-term care and a national nursing homes without walls program?
Oh, Jane, big questions. Will there be long-term care standards? I think so. I think it may be challenging to get there. I think there's already work that's been done, as we know in Canada, around long-term care standards and what is necessary. I certainly hope that what we've seen with the pandemic and what we're learning, as well as we continue to work with older adults and with communities, and that we realize what's been happening, that we have governments at all levels of governments realize the importance of these long-term care standards. And so I have some hope, yes, that we will actually get there for the long-term care standards. For nursing home without walls, I think it will likely expand to other venues and not just nursing homes. I'm already getting requests from community centers to see how they can best try to implement the vision and the model that we've developed. And I tell them that certainly, and as the one of the last comments was, maybe we're already doing that, but in a different way. I think we have to be very conscious of that. And I also think it depends what's needed in the community. If we need a nursing home, it's because people need to come into that nursing home because there's a need there, or there's something that is needed in that institution. And but a national, there's certainly interest. I'm not sure if by 2028 we'll have a national nursing home without walls. However, I have more hopes maybe for the long-term care standards, and maybe it should be the other way. I'm not sure.
Goodness, I don't know. I don't know whether we should think about another pandemic to push the needs.
Oh, I hope not. No.
but I think we must get tired of the rhetoric around we must do better. So I think this conversation today has really highlighted once again the importance of integrated approaches, and that's really what, the program Nursing Without Walls is part. It's an integrated approach. But I do also want to go back to Dominic Boyd's comment, which really struck a chord. And that is, the need for purpose and meaning does not stop when we reach 65.
No.
And I think that's the essence of this conversation. And Antonio built the conversation out to talk environment. We talked about funding, sustainability, investment versus costs. So really, we're talking about how do we create an environment, and that also means political environment that enables all of us, but all of us at different times in our life, to do what we have reason to value. And it goes from those, women with prams, what do you call them, strollers, to people that, an athlete that may have some mobility challenges.
Definitely.
And so we really got to take aging out of the conversation about creating environments that enable.
Yeah.
So I'm just going to ask Bruna now to turn and put up the tile for next week, so that I can introduce the fact that, you know, we'll be talking about lifelong learning in the healthy aging discourse with Eileen Sweeney, and Eileen is with us today, I know, and also Celine Clark. So join with us next week, 7 a.m. Eastern Standard Time. And I've got some pretty tricky questions about lifelong learning, and how do we really ensure that there is access? And Antonio, it comes back to environment again, you know, and how do we create the structures that are accessible and appropriate? At the same time, I want to encourage you to think about coming to our global conference in Bangkok next year, 27th to the 30th of June. And in the weeks to come, you know, we'll talk a little bit more about that, you know, call for abstracts, registration, but also some of those key people. Before I hand the floor to you, Suzanne, and I'm going to ask you to give us your takeaway messages, I want to acknowledge all members of the IFA team. Thank you for allowing me to be part of your team too. And also the experts in comms, Jasmine, Luana, and Bruna. So, Suzanne, could you please give us your takeaway messages from this extraordinary global cafe?
I think 2 messages, and maybe it'll touch on topics that we didn't have time maybe to delve into, but I would say that we need to keep in mind when speaking or talking about aging in place that it could be also aging in the right place, that aging in place or aging at home, the home could look very different depending on what we are referring to, what the needs are, what, you know, what types of support or how involved the person is. So I think we need to really consider aging in the right place. In the work that I do, that right place for now is more community. I would say that we also need to keep in mind that these are things that can be planned, but we rarely talk about as well. And we really have to keep that in mind. And my last message would be, and I think you touched on it actually, Jane, just now, is I never look at a continuum of long-term care. I look at a continuum of autonomy. And the goal is always to bring the person back to their the level of autonomy that's their maximum, their full capacity, I guess. And that can look different from no matter the age, no matter the circumstances, but we should always be looking at that level of autonomy or independence and providing that empowerment and the tools that people need to do so.
Thank you very much, Dr. Suzanne Dupuis-Blanchard from the University of Moncton, for being with us today, and everybody from around the world.
Yes.
So we appreciate your presence and your contribution. Be well, and we'll see you same time, same station, 7 a.m. Friday next week. All the best. Bye-bye.